Okay, so this time we're going to be talking about Cellcept. The generic is Mycophenolate, and Azathioprine is generic for Imuran. These are both anti-rejection drugs. I've taken both of them. I'm currently on Cellcept, and I'll be starting my Benlysta injections in a few weeks. So, Imuran or Azathioprine is I feel, in my personal opinion and experience, not as effective as the Cellcept or mycophenolate. It just doesn't seem to do as much, but I do have a lot more hair loss on the Imuran. Like a lot more. It's very noticeable. Both drugs, the first few weeks that you start them, you will probably, not everybody, but I know I was very nauseous for the first few weeks. And then that slowly dissipated. I mean, I still get nauseous every once in a while on the Cellcept, but it's much less frequent. It's not like a constant annoying thing. I don't like the Cellcept. I don't like it for a few reasons. One, because I feel like it's not doing enough for me personally, and two, it makes you have no appetite. Since I've been on it, I've been having trouble sleeping, and also, a lot of lupus patients or people with autoimmune disease in general end up getting other autoimmune diseases like interstitial cystitis, which affects the bladder. I think that they believe it might be an autoimmune disease. Regardless, I do have IC, and I have noticed that it has gotten much worse on the Cellcept, which is another reason I just don't like it. Because it's not a pleasant thing to deal with to begin with, and then, you add something like Cellcept and it just aggravates it, and then it really becomes unmanageable. I don't really remember having any side effects of the Imuran other than the hair loss. I mean, it's nothing compared to the hair loss you experience just from the lupus on its own, but it's definitely noticeable and unpleasant, that's for sure. God, the Cellcept, I don't like a lot of the side effects. The other thing is, I get sick a lot more on the Cellcept. Like, I have an impacted wisdom tooth. I'm having trouble finding a specialist to like yank this tooth out because I guess it's oral surgery, and so I've had this get infected like 3 times. This will be like the 4th time, and I just got my Benlysta delivery because I was off of it for a while. Now I'm going back on it, and I'm waiting to take the Benlysta, and even had to stop the Cellcept. So now I'm just on Plaquenil. If you're in a position where your anti-rejection drugs, whether that's, I don't care what it is, cyclosporin, Imuran, Cellcept, whatever anti-rejection drug you're on, isn't doing enough, and obviously if that's the case, then Plaquenil or hydroxychloroquine wasn't doing enough, every time you get sick or you get an infection, you have to stop the anti-rejection drugs or any biologics usually that you're on for at least a couple of days or until the infection starts to get better or you're done. Usually they recommend until you're done with a course of antibiotics, just in my experience, right? So you're already in a position where what you were on wasn't doing enough, and then you were constantly getting infections, so you're constantly having to stop them. And I mean, I don't know about you, but within days I definitely notice that I feel horrible until I'm able to start, taking them again and my infection's gone. And it takes a while, at least a week, sometimes 2, for me to start feeling better again just from stopping the anti-rejection drug. So getting infections and getting sick with like respiratory infections and this kind of thing all the time is obnoxious. And that's something I definitely experienced more of with the Cellcept. I mean, this side of my mouth is so swollen right now, and I'm on like day 5 on clindamycin, like 300 milligrams 3 times a day, I think. And it's just not going away. I'm kind of getting a little nervous because usually by day 3 or 4, it starts to subside. You know, the infection starts to get better, and it's not. So it's not good. That's when I noticed with these anti-rejection drugs. Trying to think if there's anything else. I definitely would not get nervous if you're very nauseous at first. Don't get nervous because it usually will go away. I know a lot of other people with lupus, and after a few weeks, sometimes even a couple months, it got better. So, try to be patient. I didn't really have any other side effects, even with the Cellcept. I just noticed trouble sleeping, definitely more infections on Cellcept than the Imuran, the increased symptoms of IC, no appetite. I mean, no appetite. Like, I have to force myself to eat. It's terrible. And I'm already very petite as it is. I don't know if you can see, but I'm really small as it is. So, I have to force myself to eat. It's really bad. Sometimes I'll go all day, and it's not even like I'm just not hungry. It's more than that. It's a complete aversion to food. Like, you don't even want to think about eating. It's weird, but I don't appreciate it very much. So I'm hoping that at some point I could either go on something, other than Imuran or Cellcept, with the Benlysta, or hopefully would be really nice to only need the Benlysta alone, but I don't know. We'll see how that goes in the future. That's pretty much it. If you guys have any questions on Cellcept or Imuran, definitely leave them down in the comment section, and please subscribe so that I can get this information out to other people that need it. And yeah, I'll be making more videos about steroids, about a lot of different things that we deal with. Thanks for watching, guys.